Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. Thank you and welcome to our weekend clinic. Today it's a day of joy because we are still standing. Now, today we're going to talk about the possibility of pregnancy at age 49. What are the options for a woman who still wants to be a mother at the age of 49? What are the options left for this lady? Is it possible for this lady to become pregnant naturally? Is it possible for her to also employ other avenues to succeed in becoming a mother? Is it all over for her because she's 49? So those are the questions we're going to answer this evening. So please, once you join, let me know who you are, introduce yourself, tell me where you're located, and we're going to spend about 20 minutes to understand this concept, and it's going to be very entertaining. It's going to be very educating because you're going to learn the different ways you can still succeed despite the odds you might be facing. So please quickly make yourself comfortable, type in comment, let me know who you are, and as soon as possible, I'm going to start. Immediately after this clinic, I'm going to run another clinic in Facebook. It's going to be the same topic. So if you're not in our Facebook, I encourage you to join our Facebook conversation. Now, a couple of housekeepings before I start. The 26th of November is a special date in our group. We have a super masterclass. So listen to the rhyme, super masterclass. We are gonna talk about gender selection, gender determination. So is it possible to have a specific gender you've always wanted to have? Is it possible to have a baby girl, a baby boy, twin girls, twin boys, mixed quadruplets, mixed triplets? Is it possible? The answer is yes. The last Sunday of November, we're going to devote it to gender selection. So if you've always wanted to balance your family with a specific gender, that's okay. This is 2023, so it's possible. But there are fewer ways you can achieve this. So make sure you register. Registration is currently ongoing, so register. Make sure your partner will be in attendance and you won't have any regrets. So let's talk about the topic for today. So you see, if you have this beautiful female reproductive system, it's actually a reminder you're a mother. So every girl child is a mother unless she doesn't want to be a mother. Now, what are the evidence that makes every girl child to be a mother? The ovaries. So when you're coming into this world, you're coming in with the complete set of the eggs, which will eventually translate to your family. Of course, you're not going to use all those eggs. They are in millions, and they are not all going to be useful. So as you're getting older, the quantity and the quality of the eggs will be depreciating up to the point that a time will come when you will no longer have them. Now, conventionally, as a woman is aging, her fertility will be reducing. The best time for a woman to succeed in becoming pregnant naturally, effortlessly, is in the mid-20s. That's when you have the highest potentials of becoming pregnant by yourself. So long as the eggs are good and all the reproductive systems are okay and you have availability of sperm, you can easily become pregnant in your mid-20s. Now, as you're tending up, when you get to about the age of 37, there will be a sharp decline in your fertility. Your fertility is actually defined by the quantity and the quality of eggs you have. Now, the reason why you don't have enough eggs as you're getting older is because every month, your body is structured in such a way that you are supposed to be pregnant every month. The original design of all women is to release their eggs, and once you have availability of the sperm, you become pregnant every month. So every month, you release your egg through the process of ovulation. If that egg is fertilized by presence of the sperm, you will become pregnant. When you become pregnant, you are not expected to bleed again. You will carry that pregnancy up to 9 months. You will deliver the baby, then your body will begin to come back to normal again. Now, it's a time-framed process. Women are not always going to have the eggs. As they keep releasing the eggs, we age with time, they will no longer have eggs. So a woman at 49 is classified as either perimenopausal or menopausal. So we don't know the status of this lady at 49. Has she really graduated into full menopause? So what will make a woman to be into full menopause? There are criteria of classifying a woman as menopausal. A woman will be classified as menopausal, either early menopause or normal range menopause, if she has not had her bleeding for 12 consecutive months. So a period of 12 months amenorrhea. Amenorrhea is absence of your bleeding. So if previously you used to bleed every month, you have a regular 28-day cycle or 21. Remember, the normal range of your cycle is from 21 to 35. Then suddenly, for example, if the last time you had your bleeding was in October 2022, and up to November 2023, you have not had your bleeding, it's possible you've entered menopause. So if we get the history from this woman that she has not had her bleeding for the past 12 months at age 49, possibility she's gone into menopause is high. Now, if she still bleeds, then she's likely perimenopausal or premenopausal. Now, women that are perimenopausal and premenopausal will have reduced fertility by default because you have fewer eggs, if at all you have. Now, out of those fewer eggs, just few will be of good quality. So they will struggle to become pregnant. So number one option for this lady at 49, it's still natural ability to become pregnant. So she can still become pregnant naturally, though limited, very, very limited chance, but it's still there. There are some women that can still become pregnant naturally at the age of 50. There are some women that will have delayed menopause. Their menopause will either be mid-50 or early 60s. So long as you produce eggs, God can multiply your one egg into many. Matter of fact, when you are older, you have an opportunity of having multiple pregnancy way more than younger ladies. So the first option for this lady at age 49, if we have a full picture of her medical history, is to continue the PPP method. PPP method is the method we use in addressing all manner of infertility in our group. So the first P simply means you pray to God every day you wake up. The second P means regular lovemaking. Regularity in our group is every other day. So that means you make love today, you skip the following day, you continue until you become pregnant. Can this woman become pregnant naturally at 49? Yes. What are the chances? Very limited. But do we have a chance? Yes. That's your number one option. Number two, you have to yield to assisted reproductive technique. If your male partner, it's good, fertility-wise, that means your male partner has quality sperm, good count, good motility, good morphology, we can start you off with IUI. IUI simply means intrauterine insemination. So if we confirm that at least one of your tubes is still open, and if we confirm you can still ovulate, or if you're not ovulating, but we confirm you must still have some eggs, we can give you ovulation induction drugs. And once we target when you will likely ovulate, we're going to introduce the sperm, then you become pregnant through IUI. Now, if that one doesn't work, then we are going to graduate to IVF. In IVF, it simply means we are still going to see if you have eggs, and we're going to collect the eggs. We're going to collect your partner's sperm outside your body. We're going to get you pregnant when we put it back into your body. That's IVF. Now, the second option of IVF is IVF with donor eggs, because possibility you might no longer have good eggs at age 49 is very high. Now, if that one doesn't work, then your final option of pregnancy is surrogacy. So if at 49 you've gone into menopause, or we don't have a good chance of going for donor egg IVF, probably your body is not user-friendly, then we are going to look for another woman that will become pregnant for you. That woman that will become pregnant for you is called a surrogate. During surrogacy, we're going to find a convenient, younger, healthy lady with proven ability to become pregnant. Then we are going to use her as a vehicle that will have your baby. Two options. If you still have eggs and we are okay with your eggs, We can actually collect your eggs, collect your partner's sperm. So instead of doing the IVF in you, we're going to do the IVF in the lady. That's simply what surrogacy is all about. Surrogacy is IVF in an external lady that will carry your baby. Now, if we don't have good eggs, we're going to do donor egg, sperm, or donor egg, sperm, both of them in the surrogate. So you have to have a memorandum of understanding with the surrogate that once the baby is born, the baby will be fully yours. It's a legal process. Now, the last option, which will make you a mother, but not necessarily pregnant to become a mother, is adoption. So these are the stepwise way you can still become a mother in 2024. It's not over. If you are determined, if your mind is made up, if you're sick and tired of being bullied, or being castigated, or being stigmatized, you can defeat infertility, you can look infertility eyeball to eyeball, and you can still be a mother in 2024. Just follow the stepwise process. So while you're waiting for God, while you're praying, you keep on practicing your PPP. You can become pregnant naturally. Now you need to seek help immediately. You need a fertility specialist because we need to look at your package. We need to look at your fertility index. We need to conduct our hormonal test. We need to look at the whole fertility reproductive system to know where you stand. Then when you activate this, we're going to go stepwise. So if the natural ability to become pregnant fails, we're going to give you some fertility drugs. If that one fails, we're going to graduate to IUI. If IUI fails, we're going to graduate to IVF. If IVF fails, we're going to go to surrogacy. And eventually, if surrogacy doesn't favor you, we'll go for adoption. This is how to become a mother in 2024, despite the fact you might be 49. That's my presentation. I'm going to open the clinic now to give you an opportunity to ask your questions. I can see our amazing COO is in the clinic. I can also see Kelvin. Kelvin is one of my students from the mentor group. So the clinic is going to open now. And Kelvin, since you're the only medical student in the clinic today, I want you to ask me 3 questions. So ask me 3 important questions. Okay, so start asking your first question. I'll provide you the feedbacks. You ask your second question, I'll provide you the feedbacks. Now, immediately after this particular clinic, piggyback to me. I appreciate the fact you were able to attend. You're the only student that attended. So piggyback to me. I'm going to get back to you. You need to have some incentive. So Kevin, please start preparing your 3 questions. COO, you can also go ahead and ask your question. So let's see. Okay. So I'm waiting for your question, Kevin. COO, you can also feel free and ask your questions. Remember, if you live in Nigeria and you want to consult with me, it's possible. Just go and start by starting a package. 1 week package, 1 month package, 3 months package, 6 months package, ANC package, whichever one you can afford, Conless Fellowship. Now, this is November. As a woman, you only have 1 day to become pregnant in November. That's the day the egg you release will be fertilized. Unfortunately, that egg will be viable for 24 hours. Once you release your egg for the month of November, if we have availability of a sperm, within the 24-hour window you release your egg, you will become pregnant. Now you have a fertility window which opens 5 days before your ovulation and closes a day after. That's the 7th period you have the possibility of becoming pregnant in November. Once you miss your November chance, you will enter December. Once you miss your 1 day in December, that's it for you in 2023. You begin in January 2024. Personally, I don't want you to get to January 2024. I want you to nurture your pregnancy from January. So if you don't know, you have to keep on showing up every day. So we don't time our love making in our group. We encourage you to make love every day. Do you know why? Once we have availability of healthy sperm, and probably because of some reasons, your cycle change. So instead of ovulating on a particular day, you will ovulate on a different day. So long as we have the sperm, you can still get pregnant. So that's the tiebreaker. Okay? Where are the questions, please? Kelvin, ask your questions. I know you're a younger medical student, but I want you to ask me questions. Then I have another question from Yeti. Remember, if you're a medical student under my supervision, I need you to put your name and your level in this clinic, okay? All right. Will multiple fibroid surgery affect your chances of getting pregnant naturally? Yes. I'm going to explain. You've done one open and one hysteroscopic myomectomy, and you're 41. So here's the deal. Everything related to your fertility with fibroid is dependent on the type of fibroid you have. We principally have 3 types of fibroids. Now, the 2 types of fibroids we worry about are the type of fibroids that will occur inside of the womb. The first one is called intramural fibroid. The second one is called submucosal fibroid. These are the 2 that will have consequences of affecting your fertility. Number 1 criteria for fibroid affecting your fertility is location. So if you have an intramural or submucosal fibroid, then possibility they will affect your fertility is high. Number 2, size. If those intramural fibroid and submucosal fibroid are bigger than 5 cm, up to 6 cm up, possibility they will occupy the space where your baby will implant is very high. So they can impact your fertility. Now, how can myomectomy affect your ability to become pregnant? It depends on how the myomectomy was done. Naturally, we encourage fertility-sparing myomectomy. Fertility-sparing myomectomy means when we are conducting the removal of that fibroid surgically, we are gonna be careful. We are not gonna go invasive in the cover of your womb, which is called the endometrium, because when we go invasive into the cover of your womb, when your womb is healing, your womb can heal with adhesions or scar tissues, a condition that can also affect your womb. So if you have extensive scar tissues in your womb, they can come together, they can form what we call uterine synechia or Asherman syndrome, and the normal pathway that your baby should implant will not happen. So it depends on the type of surgery you have. And of course, you mentioned you've had 2. So unfortunately, some women can have repeat myomectomy because when you remove the big fibroid, the smaller fibroids can quickly get bigger and will have a need to remove them. So what you need to do, don't just focus only on the female aspect of fertility. We also have to look at your male partner. And we have to advise you appropriately. Can you still become pregnant at 41? Of course, but you need help. So we need to look at the totality of your hormones. We need to look at your tubes. We need to look at other parameters. We need to look at your partner's sperm. Then we advise you on what you need to do. Now, if you have been pregnant in the past and currently you're not able to become pregnant, you have a condition we call secondary infertility. So secondary infertility is a situation where in the past you got pregnant, but subsequently you're not able to become pregnant. That type of infertility can be more responsive to treatment. But if you have primary infertility, it means in your lifetime, you have never been pregnant and you're still struggling to become pregnant. So between primary infertility and secondary infertility, primary infertility is more difficult to handle, okay? So I hope that's very clear. Okay, so that's the first question. Catherine Asogwa. Okay, so you're medical student, and you're excited to join, so you can ask your question. Queen, I can see you. What are the risks associated with being pregnant at 49? I love this question for so many reasons. Now, here's the deal. As you are getting older, possibility that the egg that will eventually be fertilized can actually have some chromosomal abnormalities high. So number 1 risk factor for women that will become pregnant at this age, 49, is possibility of being predisposed to having babies that might have chromosomal abnormality. So having chromosomal abnormality means when the man and the woman are coming together to join the chromosomes, remember the mother will bring 23, the father will bring 23 to form 46, they might have some error. So the possibility of developing abnormal chromosomal structures like having Down syndrome, Edwards syndrome is higher in elderly women. Possibility of developing preeclampsia is higher. Possibility of developing gestational diabetes is higher. Possibility of having preterm delivery is higher. Possibility of having low birth weight baby is higher. So the older you are, the more the complications that might be affecting your pregnancy. Now, once you are 35 and you want to become pregnant and you succeed in becoming pregnant, you are classified as advanced in maternal age woman. So we have to give you regular appointments because your pregnancy is at risk. So the older you are when you become pregnant. So for this lady at 49, Possibility, number one, she's going to be delivered through CS is very high. Possibility she might have miscarriage is very high. Possibility she might develop gestational diabetes is very high. Possibility she might have preeclampsia is very high. Possibility chromosomal problems can come in are very high. So we have to carefully work her up, make sure she gets to 37 weeks, which is STEM, then we can decide how to deliver her. The overall aim in a woman elderly, a woman older than 35 in pregnancy is to make sure we get the woman to safety. Now, during pregnancy, the safety net is 37 weeks. If you are able to carry your pregnancy up to 37 weeks, then when the baby is delivered, we are going to assess you and your baby and you can go home. But if your baby is not up to 37 weeks, when your baby is delivered, your baby will be referred to neonatal intensive care unit until we are sure that the baby is good before you can go home. So the target in majority of pregnancies is to get to 37 weeks. Okay? All right, so COO asked exactly the same question that Queen asked. So if we don't have any other question, it's actually 28 minutes, so I'm going to be rounding up. But if you have any question I didn't provide feedbacks, please ask. Kelvin, you just announced your presence and you disappeared. So it's actually only Queen that asked questions from the medical students. So guys, if you have any questions, quickly ask before I go. The sound variation is changing. When I started, the reflections were not visible, but now it's kind of visible. It's affecting my view. But I hope you guys are still able to follow through. Okay, do we have any other question? Quickly ask before I go. All right, so thank you so much. My next clinic in YouTube will be on Tuesday. So my clinics in YouTube are Tuesdays and weekends. Tuesday, 6:30 p.m. Eastern Time, US, then weekends, 3:30 p.m. So I'll see you guys in Facebook. If you're in Facebook, join me. We continue this discussion. Until I see you, thank you so much for coming, and God bless you and bye.